This is Dr. Tom Etter, and this video is going to cover some of the common conditions of the knee and some of the chiropractic treatments for those common conditions. One of the most common injuries of the knee is a tear of the meniscus. The meniscus is a stabilizing pad inside the knee in this area right here. When the meniscus is torn, it often happens when the knee is twisted while it's bent. Oftentimes, if there's a tear in the meniscus, it causes a pain on the middle of the joint line here. Also, if the meniscus is injured, the knee oftentimes doesn't fully lock and it has kind of a springy block to it from locking. When the meniscus tears go untreated for quite some time, it can also lead to problems with what's called the ACL or the PCL. When there's a problem with the ACL or the PCL as far as rupturing of the ligaments, there will be laxity in what's called the drawer test, and what that involves is pulling forward and back on the knee. If the knee has excess motion in this motion, it's sometimes suspected that there can be a tear of either the ACL or the PCL. The next common problem of the knee is called patellofemoral pain or patellar tracking disorders. The patella is inside the tendon of the quadriceps and it slides up and down on the knee. If the patella doesn't slide right, it can cause pain. Oftentimes, if you press down on the knee or on the top of the patella while the knee is extended, if it causes pain, it can be said that there may be some type of patellar tracking disorder. Oftentimes it's said too, the patellar tracking disorder can be called jumper's knee. And one of the most common and effective treatments for patellar tracking disorders is myofascial release on the tendons of the quadriceps. Go ahead and turn this side right there. And so when the tendons of the quadriceps are treated with myofascial release, oftentimes the patient lies in this position and then bends the knee as the tendons are worked in this fashion here, and both above and below the knee. And that's basically what it looks like. And then go ahead and turn back onto your back. And then the last type of condition of the knee we're going to be covering is called the iliotibial band. The IT band is a muscle which comes from the hip to the knee and acts primarily to stabilize the knee when it's fully locked. The IT band is in this region right here. Oftentimes, if there is pain with the IT band or a problem with the IT band, the pain is at the side of the knee and can radiate up into this area here. Also, the knee tends to be painful when bent from fully locked to bent to about 30 degrees. It causes what's called a painful arc. The IT band is also commonly treated with myofascial release techniques, and it can be treated in this fashion here with contacting the knee here and then drawing the leg across in that fashion. One of the most irritating things for IT band syndrome is running uphill, and that's one of the most common conditions in the knee. That is it for this video on knee pain. Thank you for watching the video, and if you have any questions, feel free to contact me and I'll answer them the best I can.